Welcome to another episode of the HealthCast. I'm super excited to have Dr. Nan Nuessle on, locums pediatric hospitalist and founder of Beatdown Burnout. Welcome, Dr. Nan.
Thank you so much, Phil. It's a pleasure to be here.
It's a pleasure to have you on. So you're a pediatrician working in a locums capacity in a hospital setting. Let's just start with your background. How long have you been a doc?
Goodness. Entered residency in 87, so graduated medical school. Entered residency in 88, graduated December of 87 from medical school. So technically that's when I became a doctor.
Sure.
Finished all of my training for both pediatrics and medical genetics, summer of 91. And practiced both medical genetics and general pediatrics for about 15 years, and then dropped the genetics and did just the pediatrics.
Yeah, that's a lot. Was that medical genetics across the lifespan or in the pediatric world as well?
Across the lifespan.
Okay.
From prenatal testing to degenerative diseases.
Yeah, that's impressive. Yeah. So long a career as a pediatrician and a genetic specialist. Tell us how you came about to what happened in your career, maybe highlights and maybe perhaps low points that led to you developing Beatdown Burnout.
Sure. So the place where I was initially at, I stayed there for almost 20 years, worked my way all the way up to chairman of the department at the clinic, which was a huge multidisciplinary clinic, and also one of the nearby hospitals. The administration there was not sensitive to the needs of general pediatricians or even primary care in general. They were very much into rewarding the high wage earners, the orthopedic surgeons, cardiovascular surgeons, and the rest of us were working 20, 30 hours more than average and bringing home probably 50 grand less than average. So
more time, less pay.
More time, less pay.
Doesn't quite balance out.
I just couldn't continue to do it. So I left there and explored a number of other options. I had a solo practice for a while that was all call-based. I worked in a number of different clinics where I was doing traditional medicine, which is both inpatient and outpatient, and eventually started doing that just as a locum. And as a locum, my recruiters encouraged me to try just doing the inpatient side, just the hospital side. And honestly, at first that terrified me. That meant that if a baby coded, it was on me.
Yeah.
And so I put that decision off, pushed it off for about 3 years, and then finally went ahead and tried it. And I love the lifestyle of being a pediatric hospitalist, especially in rural America, where most of our patients, most of what we're doing is newborn nursery. What could be more fun than working in a place where instead of losing patients, we're celebrating new life?
Mm-hmm.
Every day we're celebrating new life. Do I get kids that code? Sure. 1 to 3 times a week.
1 to 3 codes or pediatric codes per week?
That's a newborn nursery with an average daily consensus of 6 to 8.
Okay. I've worked predominantly rural medicine.
Getting them back can often be the easy part, because then you've got to get the kid transferred to a hospital with a neonatal intensive care unit. Even if the weather is ideal, it can take 2.5 hours for a transport team to get there from an hour away. And the weather's never ideal. For example, I had one where I've never seen this before. We had something called freezing fog. And of course, I didn't get to see it. I didn't get outside of the hospital at all that day. I only saw the photos on Facebook for my friends later. We waited 10 hours for the transport team to be able to safely fly in to our location and take that baby out. So those things are not unusual. My average wait times are probably about 4 hours.
Yeah.
I've got to keep that baby not only stable, but make sure I'm gathering all the information that the neonatologists are going to want, that the transport team's going to want, that the family wants. They're all of their questions, both the questions that they ask and the questions that they're afraid to ask. That's all part of just doing that management of a kid who crashes.
I hear that. Yeah, that's it. I hear a lot of passion in your story, and you've had a long journey. It sounds like this is what I've heard so far. A highly skilled physician, some frustrations at different points, and with regarding pay and reimbursement and whatnot, and found a new drive, a new motivator with pediatric hospitalist care. And how did you come to develop Beatdown Burnout?
So I was heavily recruited by a hospital in the Southwest because they were reopening their labor and delivery unit, and they were looking for experienced pediatric hospitalists who could come in and help them reopen this unit. And they brought me in as a locum. When I got there, the team was fabulous. Everyone had each other's back. Everyone was knowledgeable. Things went really smoothly. And about 2 to 3 months into the job, things started to change. And I realized that everyone who had opened that new unit was a traveler. All the nurses, the nurse manager, the other physician. Well, one of our OBs was permanent and the other two were not. So eventually we switched over to more permanent people. And when we did, I ended up with a charge nurse who absolutely hated me. And I have no idea why. And she made it her mission in life to make me miserable. Rounding on my patients in the morning. And as soon as I left a room, she would go in and talk to the parents and basically tell them that everything I said was a lie and was not founded in science. And all I'm doing is following American Academy of Peds guidelines.
Sure.
And hospital policies. And she's going in and doing this, would argue with me in front of families, and then got to the point where she was withholding information on couplets prior to the baby being born, which is an extremely dangerous position for me to be in. If we've got a high-risk delivery, and I don't know why we have a high-risk delivery, that's a problem. And then I learned that she was bullying several of the nursing staff in the unit. And as I looked into this more and more, I found out that every one of our nurses was either on medication for anxiety or depression or both. Most of them, it had started after she came.
Yeah.
I couldn't sleep at night. I was having migraines.
Mm-hmm.
I was gaining weight no matter what I eat or how much I exercised. Meditate for an hour before going into work.
Love meditation, but you mean just to prep for work?
Yeah, just to prep for work. I would still sit in my car in the doctor's lot, dreading getting out of my car and going inside. And a friend of mine said, well, I do this coaching thing. We're having a master class. It's 2 hours a night on Thursdays for 6 weeks. Why don't you come check it out? And I learned a lot and signed up to become a coach right after that. And halfway through my first coaching course, I began using those skills that I had learned. And it was all about personality-based communication. And I could tell from the way this nurse manager acted what her personality type was in this system. And I began to completely change how I communicated with her.
Once you could see it differently.
Yes.
Yeah. Yeah.
And then she didn't know how to respond because she couldn't argue with me because that went against her core values.
Yeah.
So I shut down the unit bully in 3 days. And from there, within 3 weeks, I was being asked to do conflict negotiation in other units. I started teaching some lunch and learn classes. Not only did we decrease the conflict in certain units that were a problem, but we got our units to start talking to each other. So we de-siloed the hospital in the middle of COVID.
Say that word you used. What would you do?
We de-siloed the hospital.
Okay, like compartmentalize. You remove that so there's more engagement and cohesiveness and interaction.
Yes. So before I started that work, people didn't want to leave their unit and go cover another unit that was short-staffed.
Sure.
They don't like us. They never talk to us. Why would I want to go help them? Cool. I get to go learn a new skill today.
Totally. Yeah. And I love the lunch and learns too. It's a good use of time and to just keep filling your brain. So good for you. So did you know that this before you took your friend's course, did you know that there were issues that needed to be addressed? I mean, or were you just learning it as you went?
Oh no, I knew there were issues. I mean, I had gotten bullied in medical school. I had watched other people get bullied in training. And then I saw it again in that first job that I had. I noticed that people who looked different or sounded different were treated differently. So if your skin color wasn't the same, if you had some sort of birth defect on your face or scars on your face, or you spoke with a different accent than the people around you, then what happened is you got a less favorable call schedule. And when it came time to bonus people, you got the short end of the stick.
Mm-hmm. Yeah. That's frustrating and unfair and
very hard to prove.
Yeah. Somewhat evasive. Yeah.
Yes. And the other thing I noticed is anytime anyone fought back, There was retaliation, even in the places that had no retaliation policies.
These are some of your awarenesses prior to taking your course.
Being a coach, yes.
And you kind of jumped in with both feet. You took one course for yourself, maybe, and then I heard you took a coaching course.
Right.
And then you were had positive results with your bully, and beyond that, then management must have noticed something, and what you were requested to help in other departments.
Yes.
Awesome.
Yeah.
And how did things build from there?
From there, I was at about not quite a year after this journey started. I was asked to do an organizational training for a cancer center that had a big problem with staff retention. They literally had a 95% staff turnover rate and had for over 2 years. And it came down to 2 departments where they literally could not keep anyone in those 2 departments, with the exception of one receptionist who said, I'm 2 years away from retirement. I'm not quitting. I don't care what they do. So basically it had to do with the 2 male physicians who were heads of each of these 2 departments. They'd had some sort of falling out and refused to speak to each other.
Like the playground.
Yeah, a lot like that. And so when they shared patients together, they would not talk to each other about the treatment plan, about potential side effects, about coordinating appointments.
Not okay. That's a disservice to that community.
Hugely. And so what they would do is they would tell their nurse to call the other doctor's nurse and take care of it. And the nurses are like, this is moral injury because this is not our responsibility. And so the nurses would leave. The techs would leave. Doctors had temper tantrums. And I came in and I did a single weekend training, and we did a follow-up 2 weeks later. Those 2 physicians completely changed the way they communicated with each other, including all their policies regarding communication. And as of that 2-week point when we did the follow-up, they did not lose another staff member out of either of those 2 departments for over a year. Their staff turnover went from 95% to 5% in 2 weeks, and it stayed there from January when we did the training through the end of the year.
So these are skills that's amazing. And these are skills that I was wondering about the continuation of them, whether things reverted, but these skills are applicable, and these communication skills or understanding are applicable and have some longevity to them, where they must be, I don't want to be diminishing and say easy to apply, but they're impactful.
They are impactful. They're hugely impactful. And the exercises we do in the training really break down the barriers between people. What I learned in that was that I did not have the training that I needed to help these 2 gentlemen deal with whatever trauma had caused their falling out.
Individually, not their own, not trauma, not doc to doc, but individually that they brought to the table.
Right. That they brought to the table before they ever went into medicine, that shaped how they responded to certain triggers.
Yeah.
And so I went on a journey to find a course where I could become trauma informed. And a lot of those courses are $15,000, $20,000, $25,000, which as a pediatrician, that's like out of the question. If I were an orthopedic surgeon, that would be like, okay, no problem. So I finally found some place. And not only did I get trauma certified, but I became NLP certified and a master in NLP, a master in somatic coaching, a master in the quantum energy release, which involves timeline work and all these other things. And actually just finally got the trauma informed certification in the last month. I have so much more confidence in my ability to manage with whatever they bring to me. And I practice it every day in the hospitals. So I know it works.
I talking about trauma, I tell people we all have a story. Did it help you, I guess, maybe aside from just filling a business need and making your work environments more comfortable, did it provide something for you in your personal life and maybe some greater understanding?
Well, when I was 5 years old, I was burned in a fire, and it took all the skin off my face, up into my hairline, back behind both ears. I burned my hands. I burned part of my chest. And this was in kindergarten.
Yeah.
3 weeks before the end of the school. Well, I was in the hospital for 3 weeks and then got home 3 weeks before the end of the school year, and they wouldn't let me go back. And I didn't really understand why, but it was because my mother was afraid of the other children's reaction to what I looked like. I went back in first grade. And I was horribly, horribly bullied at school. Rocks thrown at me, children calling me obscenities. And then I would come home, and home was an abusive situation. Not sexually, but physically and emotionally abusive situation. Hospital was the only place I felt safe. So I went into medicine thinking that I was paying it forward from the incredible job that my plastic surgeon team did.
Yes.
But in fact, I was seeking safety. And I did not know that. I did not realize that until I did all the personal development work. And there is no safety in healthcare anymore. And that sense of feeling unsafe starts in medical school. So my goal with a lot of what I do is to create safe workspaces, places that are not only bully proof, but where we actively support one another.
That's a powerful story, and what an experience as a child to have to work through. I often, in this setting, I ask people, I meet with various healthcare business owners, all different backgrounds, docs and inventors and whatnot, and lay people, engineers. And I ask them, because I just hear passion resonating in their voice, I ask them about a sense of purpose personally back to the business. And I think you just answered that right. I usually save it for the end. I think you provided some insight there. So thank you for sharing. Thank you for sharing your story. At a certain point, you went ahead and created a second business. You're still a practicing pediatrician, but you created this business, Beatdown Burnout, with the goal of addressing trauma and creating healthier work environments in the healthcare setting.
I started out, I just wanted to tackle bullying in the workplace in medicine, and then learned that I needed additional skills. So now what I'm trying to do is to create trauma-informed workplaces so that when somebody goes off the rails, we have a better understanding of why
Yeah.
and what kind of help they need.
Yeah.
Yeah.
Pretty amazing. How has your business developed over the, when did you form Beatdown Burnout? What year?
So I started the coaching training in spring of 2020. And by the end of that year, had 3 different coaching certifications.
Yes.
And hung out a shingle, so to speak.
Mm-hmm.
November of that year, just had my first organizational training in January of the following year. So it took off pretty quickly.
Yeah. And how have things been since?
It's been a roller coaster. There are good times and bad times.
Yeah. And you want to share any highlights of maybe some, I like to start with the challenges first and maybe some success stories that you're proud of?
Well, the big challenge for me was that I really needed to get more aware of what trauma meant and how it was affecting people. And so I found a place that could do that I was comfortable working with, and took several of their courses. And as I've done that, I've started teaching classes. I have classes for physicians. I have classes for nursing and support staff. I do one-on-one work, and getting ready to start a podcast.
Heck yeah. You had mentioned it earlier, suffering to sovereignty.
Yes, suffering to sovereignty. So what I'm doing is I'm exploring people's trauma stories in medicine, whether it was trauma that they experienced in their career, trauma they experienced before their career, or trauma that they have witnessed along the way.
Yeah.
And how they handle that, and how that gets triggered on a day-to-day basis, how that shows up when it gets triggered, and how to de-escalate that, because we all have this.
Yeah. So I tell my patients, we all have a story. I was saying that earlier to you. I want to share some, can we say that my understanding of trauma is a broad term that encapsulates a lot of things, right? It doesn't, thanks.
Yeah. So there's traditionally people refer to it as big T trauma and little T trauma. So big T trauma is what meets the DSM criteria for PTSD. And that would be like the burn that I had.
Sure.
Little T trauma is the bullying that I suffered from that, which has actually had a much greater impact on me than the burn itself. But people tend to downplay their little T trauma, and they either don't want help for it or don't know how to get help for it, because they've been taught that doesn't really need help.
Yeah.
Yeah. And we need to get rid of that stigma, and we need to get to where we're helping each other with all this.
I do mention, I'm going to link trauma and mental health or mental well-being. And I do think that in my career, my 20-year career in medicine, that we've made strides with our communication with mental health regarding the topic of mental health. I think that it used to, when I started, it seemed like it was a taboo and maybe contagious. Yeah. And now it's not, as opposed to being on the periphery, now it's integral to total health.
And it's funny that you bring that up, because I am a member of the Lorna Breen Foundation's Committee on Wellbeing.
Okay.
And they have a program that they have launched in several places where they're teaching hospitals how to be the kind of workplace that attracts people and keeps them. And there's going to be a scoring system involved. But along the way in developing the first thing they wanted to tackle was making mental health care more available to physicians. And they have made a huge inroad into that at both the individual hospital level and at the state level. So it used to be that if you were getting any sort of mental health care, you had to report it on your license in all 50 states. And now it's, I think, fewer than 20 states are asking for that. That's huge. Yeah.
Having had my own journey with mental health and well-being, I really try to be an advocate. You are obviously as well, an advocate for my patients, and maybe helping them either as much as I can, or getting to people who have a greater skill set, and just having the conversation. And I think by shedding some light on things, hey, we're all people. And that I'm here to help. We're here to help, providing something, some offering, and just opening the door. I think is a good starting point. It makes me feel, for all the frustrations that we all sometimes talk about in healthcare, this is one that I'm proud of, that we've done collectively. We've moved forward.
Yes,
Yeah.
absolutely.
Any stories that you can share in particular that you're particularly proud of, or that are really amazing outcomes? Or
I think it's important for people to understand that I don't work with just physicians. One of the stories is that I walked into the storeroom one morning to get a box of Kleenex because it was allergy season. I walk in and I found curled up on the floor the housekeeper, crying her eyes out. This young woman was probably 21, 22 years old, single mom, living with her parents, going to school part-time and working full-time, and just absolutely overwhelmed. And she had no support. Her family criticized her for going to school and trying to make a better life for herself and her daughter. They felt that that meant that she thought she was somehow better than them. And it was just eating away at her and destroying her from the inside. And we met. I just had an open door policy with her. So if she was around and I was in my office, she would come in and we would talk. And a year later, she had graduated from college, moved into her own place, and got a new job as a case manager.
she's a warrior. That's a very cool
Yeah.
way to go. That's awesome. And yay to you for supporting that journey and being available. I wanted to ask how the future was going for your business. Looking ahead, how are things going on this topic, specifically on this topic of addressing trauma and improving workplace settings is what I'm hearing. And also, we throw one second part, your business too. How are those things? How is the future looking?
Well, the big push right now is the podcast. I have done organizational trainings. I've done one-on-one coaching. I've done courses. The big push right now is the podcast, and the response from my colleagues has been overwhelming. I want to get on your podcast and tell my story.
Yeah.
And because they all see the need for a more trauma-informed workplace. And I think that's really going to be exciting because as those people come in and tell their stories, I can also funnel them into programs where they can build out a trauma-informed or trauma-aware workplace based on the work that I've done in the past.
You know what comes to mind for me? I'm thinking that, again, making that distinction between, I'm going to say, personal or historical trauma and perhaps workplace-related trauma. With my background in emergency medicine, I have a lot of respect for EMS, and we have a lot of attention placed on them in our community to support them. There was a suicide last year. I live in a small rural community in Colorado, and I've been a passionate healthcare worker for a long time, but there's also, things are raw and things are challenging, especially EMS who are first on scene, and there's a lot going on there oftentimes, as you know, throughout your career. So I think I think your skill set and your purpose is much needed, and
Thank you.
kudos to you. What are some aspirations for your business looking ahead?
Oh, I would love to be able to say that I'm the person who changed 50 hospitals and created better workplaces for the doctors and the nurses and the other staff in those hospitals. It's a lofty goal, and we'll see where it takes me. But I also want to do a lot more one-on-one coaching because I've learned that that's where I can really affect change.
Yeah.
And I have a program where I work with people. I do 12 hours of one-on-one with them within a 2-week container, which means it's really intense.
Yeah.
It's generally 6 or 7 2 to 3 hour sessions in that 2 weeks.
Yeah.
And it's just 2 weeks. Boom. We get so deep and we're able to affect incredible change in that person's lives. So I want to do more than that because watching people transform like that brings me so much joy.
That's awesome. Where can people go to learn more about what you provide and Beatdown Burnout and Suffering to Sovereignty? 2
places that I would recommend. And one is to go directly to the Beatdown Burnout website. It's just beatdownburnout.com. No spaces. You don't have to worry about the case. It can be capital or uncapital. The other thing to do would be to follow me on LinkedIn. Yeah.
When does your podcast go live?
We're recording the first episodes next week. So I want to give myself 30 days.
So recording and then maybe launching out 30 days after, kind of with editing and all that kind of, yeah. I told my brother this week, I've been podcasting now for about 6 months, but my initial one, you remember the movie Airplane?
Yes.
And that pilot, I don't remember the actor's name, but how much he was sweating in the cockpit seat. And for about the first 3, that's how I was. And they've progressed and they've become a lot of fun.
A lot of fun. I've done a podcast in the past, and it really is a great way to connect with people.
That's great. Well, Dr. Nan, thank you so much for spending time with us today and sharing your career journey and your efforts with Beatdown Burnout. We'll go ahead and share all your links when we post our video today. And we wish you the best of luck in the future.
Thank you so much. It's been a pleasure to be here with you today.
All right. Thanks for joining us for another episode of the HealthCast. Stay tuned for our next episode. Thanks, guys.